Good evening and welcome to Science, Health, and Healing with Dr. Majid Ali. Welcome, Doctor. It's good to see you.
It's very nice to be with you, Richard.
And we are
very nice to be with you.
Good to be with you, too. Good to see you. We're recording this on the 9th of June. New York City is entering its grand reopening this week. We've been the epicenter of the pandemic. A month ago, the statistics were horrible. It's obvious that the city itself has come a long way in protecting itself, the people of the city. But right now, we're going into a reopening where sooner or later, there's going to be a lot of people coming in to New York from outside of the city, where they haven't been so careful, where there hasn't been such a quarantine, where people don't wear face masks. What are your concerns?
I think, Richard, what we've been doing in terms of personal precautions, which includes face mask, which includes distance spacing, which includes general common sense that you want to keep your hands clean. And then if you don't put your hands on the railing, or if you're going to put your hands on, let's say, public toilet facilities, you wash your hands right there and then. And then with those hands, you don't try to scratch your eyes or delicate tissues of this. So that's number one. We should continue to do that, and we should not draw any false security from the fact that government has taken a position that we are open now and we try to loosen up on personal responsibility. So that's number one. Number two, I think that we ought to do some basic stuff for us. Virus becomes more dangerous when we are dehydrated. Virus becomes more dangerous when our body tissues are acidic. Virus becomes more dangerous when we are under stress and our muscles are very tight, and that increases our acidity. Virus becomes more dangerous if we become angry. So the things that we have learned about maintaining good health beneath our skins under general circumstances of ordinary stress, we ought to be more careful about that. So some people learn that they do better with green tea. Some people learn that they do better with ginger tea. Some people find that ginger soup is very good for them. Some people will find that if they take turmeric, let's say, 2 capsules with 1,000 milligrams of vitamin C, that would be very good. Many people find that a little castor oil rub on the liver, on the right upper side, just beneath the ribs, and the left lower abdomen, where the colon is, castor oil there is very good, because that will break the constipation. So I think that we ought to be a little bit more attentive to what's under our own skin, because virus only forms one part of the equation. The other part of the equation is under our skin. So we should not really be neglectful of those ordinary things which make a huge difference.
You mentioned dehydration, and we're just going into summer. And it's, there's a lot of factors in summer. So you said dehydration, stress. A lot of people are experiencing a lot of stress because there's so much joblessness. A quarter of the workforce in this country has lost their jobs. So this becomes a lot more dangerous going forward.
Absolutely. Richard, there is one important, let me say this. I consider 2 words crucial to health. One is sense of one's own dignity. The other is a personal connection with one's higher being. Because I think we draw a lot of strength. If you keep listening to the television discussions of these protests which turn into violence and all the predictions about this, anybody at the end of the day is going to be exhausted. So then you try to bring a way of what I call walking, working worship, which means you are doing your work, but you try to be aware of your experience the last time you were in a church or you were in a temple or you were in a mosque. These simple things, they profoundly alter the bioenergetics of our cells and tissues underneath our skin. We just need to be aware.
Okay.
And then there is one other trick I find useful for myself, and that's why I suggest for people. That's a gift of presence. Richard, if you have a sense that this time that we are spending together, you and I, that this is a well spent time by your criteria, I happen to just present my presence to you, and you are giving me the joy of your presence. Once you become aware, I am actually writing a short books these days on the simple concept of presence. The presence can be of a pet, the presence can be of a 7-month-old baby, the presence can be a 94-year-old great grandmother. Those are secondary issues. The first issue is to be aware of our humanness, to be aware of our dignity. And when we talk about our dignity, automatically that gives us sensitivity to our concern for other people's dignity. These are simple things, but they affect our mood. They affect the bioenergetics of our body. I'm very much into bioenergetics. Okay, that's my main line of work. And so I talk about oxygen, so I talk about acidity, so I talk about insulin, for example. So a diet program, I can say this, that people who are even 5 or 10 pounds overweight, I have a program, Dr. Ali's insulin diet, and people can just Google it. I would say that is the single best thing people can do. Now, there are no products that people have to buy when they follow my diet. It's the diet, it's the food that they eat normally. For example, healthy fats are very good and they will help you fight the virus. If you are taking a lot of sugars, then sugar will produce insulin. Insulin throws you into a hypermetabolic state. That creates acidity, and that the virus flourishes on. So once you understand this basic thing, for example, what I do in the morning is I have almond oil, I have avocado oil, I have coconut oil, I have hazelnut oil, I have pistachio oil, and I have them on the kitchen table. So right in the morning, I will take, after I clean my mouth, etc., I will take a tablespoon of one of those oils. And if my impulse moves, I take another, tablespoon of those oils. These oils are the best things for our immune system. It so turns that in our immune system, the action is always at the cell membrane. The cell membrane where the virus is trying to invade our cell, and our cells are trying to destroy the virus before it can get in. Well, that action is cell membrane, and that's all fat, the lipid, that's all fat. So unfortunately, we think butter is bad for us. Unfortunately, most people know that olive oil is very good for that, okay? Most people know that coconut oil is very good. Now, let's say you want to enjoy New York bagel. So I would say one option is that you take a bagel and you take cream cheese with it. Most people do that. The other option is you just take 1/3 of a bagel, put the other 2/3 for later, but take extra cream cheese. Make it cream cheese take twice as much as you would normally do. What you've done is you have blunted the downside. Richard, yes, you have blunted the downside of starches and insulin toxicity by simply playing a little trick, which is protect yourself with healthy oils. All natural oils are healthy oils. Of course, if you're going to take French fries, that's very unhealthy oil because it's been heated to 300 degrees. Everybody knows that. I think this is doing common things uncommonly well, which makes the world of difference. So you are in a natural state with a little bit of a training. I am doing my doctor's work, but I could see the sacredness of this because if I do care for you, Richard, you will know intuitively that I do care for you. That becomes a form of worship. Now, if you know that I care for you as your physician or as a person who is sharing your company, you would naturally, spontaneously want to reward that. Now, if you once become aware that what I offered you was a simple gift of my presence, then you will very soon learn, oh, it's very easy. If he can do me a favor of his presence, I can return that favor just by my presence. I don't have to plan anything. I don't have to carry anything. I don't have to buy anything. You notice that people who live these kinds of life in Muslim cultures, they are called Sufis. Okay, but I think in Western culture, Sufi everybody knows. The Sufi poets everybody knows. What was that all about? It was all about being aware of your presence and the presence of others and the dignity of others. And when you were honoring their dignity, unknown to you, you are honoring your own dignity. A lot of this frustration that we see these days, which says unfund police, well, I think that is an absurd, obnoxious notion, okay? That's plain ignorance, okay? But what we can do, Richard, is be aware of these simple things, and we can avoid so many conflicts. Can you imagine if there are 500 people or 1,000 people on Broadway and there's a peaceful protestation march and everybody feels good about it? The children who are watching it from the windows or from the parents' automobiles, they like this idea. And then something happens, and then they start break into violence, and they start crashing the windows, and they start hurting each other, and somebody gets really very badly hurt, and so ambulance has to take them to the hospital. What happened, Richard? What happened was that as majority of the people in dignified, silent march, sharing the presence of each other, along come 2 or 3 misguided people, angry people, okay? And they neither are aware of their own dignity nor the dignity of other people. This is a process of education. This is a process of civilization. And maybe some people may not like what I'm going to say. You cannot be civilized unless your mother makes her contribution to civilizing her child. You know, ancient used to say death begins, I misspoke, that civilization begins with your grandmother. If you want to civilize someone, start with the grandmother of that parent. They were absolutely right. So when we start talking about unfund the police, and then other people who know more about these things, they will talk about that, what would be the outcome. Because the police helps incidentally, all the studies show, most the people who need it most. And they are generally the poor people. Generally, they are the people whose children are more vulnerable. They are more vulnerable. We are exactly doing opposite. So what we need to do is the wisdom of grandmothers. What we need is the wisdom and the dignity of our moms. And so if a child perceives the presence of her mother, which they do naturally, and if the child has this basic idea that my mom is a human being and she has a dignity, I must learn to honor her dignity. And then in that process of learning to honor other people's dignity, they become more aware of their dignity. I do subscribe to this view. I have 2 professors, African American descent, who are professors in New York City. They're writers, they're very knowledgeable, and I will try to be very brief what they say. They say, if you ask them what is the root of this problem of race, they say in very simple words, human beings crave control. They find that the best way to control, let's call them elites, the people who are privileged, and let's call the commoners people who are not elites, who do not have very many privileges. They make a very simple argument, very persuasively, in their beautiful simple words, and I, for one, buy that argument. Their argument is, elites want control. Elites learn from their ancestors that the best way to control other people is take away their dignity. Then they have no pride left in their moms, no pride left in their parents, or in their children, or in their traditions, or in their graves of their ancestors. So they will come up and with all kinds of scheme. For example, unfund the police. This thing is so offensive to me because we have people working in our office whose one his husband is a police officer. There is another person who actually works for the police. So when you listen to this, you say, what is the state of the mind of this person? What is the problem that this person is trying to solve? Because those people never understood that if you want to subdue someone, if you want to decimate someone, start with their dignity and destroy it. Take the dignity away from them. Because a sense of pride in your performance, in your work, in your ethics, in your history, it all comes from a sense of personal dignity. I'm a human being. I'm entitled to being treated respectfully. And then immediately you learn, then I have to also learn how to treat other people respectfully. So I was listening to them. They're my patients, they're professors, they're very distinguished people. They happen to be of African American descent, which I think makes them much more effective when they make this argument. Because most other people would be uncomfortable talking the way I'm talking because they would say, you're blaming African mothers and this or that nonsense. Okay? No, I am trying to pass to other people the wisdom, hard-earned wisdom of African Americans who were fortunate enough to get the right education, the right sense of dignity, the right family circumstances, the right pride in their work, and they know the responsibility we are teaching. There is no way on God's green earth they are going to talk nonsense to their students and teach their students. While unfortunately, many of our academics these days, they are not being fair to the students. They are trying to pass on their philosophy, which maybe belong to this type or that time. I'm not interested in that part. I am interested in focus on the fundamental dignity and decency of people.
You mentioned some, it's one example of what you would say it was an uncivilized person who might want to subvert a demonstration and cause some damage or set some police cars on fire to ruin a demonstration. There's another example, and I'm seeing them every day on the street, that people who don't wear masks. And this is what I'm afraid of because, I feel like I'm at risk. I wear a mask. But a lot of people either don't think or they don't care or they think it's a hoax. What can you say to these people?
First of all, I wholeheartedly support your notion that there is a sense of responsibility that we should have, that under these circumstances, when there is massive jamming of mankind in these marches that you see, one should be extra sensitive to other people. And so I would say, I hope that I am never like that in a setting like that, I would not wear my mask, okay? But I will tell you this, the things that I was talking about, they make the issue of social distancing far less important. Because if inside your cells are in a final determinant of failure or success is going to be this interface between the virus and the immune cell. That's the interface. That's going to be the final determinant. Because every time there is a flu pandemic or epidemic, watch what the speaker is going to say. The second breath he will say, it's the underlying condition. These people have asthma, these people have diabetes, these people have heart disease, these people have this, these people have. Over and over we are seeing that in this equation of virus versus a healthy immune cell, our success depends upon the maintaining the strength of our healthy cells. The last 80 years of our record, our experience with flu vaccine, every year we've been spending millions and millions of dollars on flu vaccines. Okay, I wrote a whole book. People were asking me, do you take a flu vaccine? I said, no, I've never taken flu vaccine. So I finally said, I will write a book on flu vaccine. And give my answer in detail for anybody who wants to be interested in that. I understand the value of defending myself under my skin and making flu not so dangerous for me. So I think we need to work on all directions. In this specific example of wearing mask, I agree with you. I would also suggest to everyone, and I would be very careful. For example, I would not walk without a mask in my own building. Okay, they have no signs there in our apartment building. But even if they did not have signs, if I saw other people were, if the people who are maintenance people who are working around maintaining the building, if they were wearing a mask, just out of a deference to them, I will wear a mask. Even though in my own mind, I think that there is a whole lot more to it. And if I can pay attention to that, I don't feel threatened.
Mm-hmm. Now, let me ask you another question, because somebody asked me yesterday, I was putting forward the thought that, well, a lot of New Yorkers have gotten infected, whether they felt the symptoms or not. And I know a number of people who've gotten, who tested positive for COVID-19, got symptoms, and thank God they recovered. But somebody asked me, have enough people been infected that we have some kind of herd immunity to this? What do you say to that question?
I think that I would say that actually the last patient that I saw before I came to you was an old gentleman, and he's had repeated infections of the bladder, and then he had heart problems. So he walked in and he was totally, in terror. And so I took him to the room and I said, he's a professor here in New York. So I said to him, let's call him David. I said, David, I think that the main thing that I offer you today is my presence, gift of my presence. And let's see if you can also give me the same gift of your presence to me. Okay. We have a very nice conversation. After about half an hour, I looked at all his laboratory tests. I listened to his lungs. I looked into his throat. He did have some gingival inflammation. So I said, we are going to do some sesame oil gargles. And because some areas were acutely inflamed, I said, I have to use antibiotics. We will use all the natural stuff. We'll give you nystatin, we'll give you probiotics. But I think I have to use nystatin antibiotics. So after all that, about 20 minutes later, he was walking out and there was a young man sitting in the reception room. So I said to him, Professor David, would you please just tell this gentleman, young man, he just came into the office, how you felt when you walked into this office about 15 minutes ago, 18 minutes ago, and how do you feel? He said, I was in terror when I walked in. And I said, now tell him, how do you feel? He says, I feel very reassured. He asked me, do you want to have an antibody test? And I was not comfortable. I said, then we won't do that. He said, but what would it tell me? I said, antibody tests would tell us that you have some resistance to it, herd resistance you mentioned. The short answer to your question is, yes, we are fortunate because a lot of people have protective antibody in us. That means the herd immunity. That means we've been exposed to low levels of the viral material over an extended period of time, and our immune system has had time to respond to it. So when antibody test is positive, that means your immune system, number one, recognizes the invader, the virus. It now gears up to respond to it, number two, and it actually has produced some antibodies. Now, you do need a lot of experience with it, because the last time I did this antibody test for someone who, excuse me, the test came back positive. So she said, what is the test? I said, the test is positive. She was very frightened. I said, but this test positivity is a good sign. It means your immune system recognized the virus. It means your immune system responded to the virus. It means your immune system makes the antibodies to it. What I thought I will not discuss with her, which I would have discussed if there were some doctors in my office or if there were medical students. The report says that this test is positive for antibody against COVID-19. But when I continued, but it could also be positive because of COVID-23, which was 3 years ago, or COVID-43. I didn't even know there was COVID-43, or COVID-229. In essence, clinical laboratory 101 says that whenever you do an antibody test of any kind, it can never be 100% sensitive. It can never be 100% specific. So I decided that I did not want to get involved with that person. I just wanted her to be comfortable with the general sense that if anything, this antibody test indicates some strength of your system rather than the weakness. Now, if I was doing a class of medical student, I would have had to spend 45 minutes and say, watch out. Before you accept this, that this is an indication of resistance or immunity, no, you need to learn a whole lot more before you get to that stage. So just like you do make your decisions, you are a teacher, you are managing, you're training a lot of people to be television experts, engineers. Just like you have years and years of experience and you're making value judgments all the time in your teaching. Similarly, doctor, first and foremost, in my view, is a teacher. And a doctor, that as a teacher, his or her responsibility is to transfer the information of the laboratory test. What does it mean to her health today? What might it mean a year from now? What might it say that you should consider? So 10 years now, 10, 20 years from now, you're in much better health. First of all, we need to, if you have a minute, we need to change our perspective. You know, whenever I see a woman who's very concerned about her child's health, let's say she is 32, and let's say that her daughter is 7 years old. And I would say, I've done it so many times that I think I'm comfortable with this. I would say, you know, your daughter Sharon, and she says, yes. Say, how old is she? Oh, she's 7 years old. I said, you know, would you consider 2 wonderful gifts for Sharon? Very, very special gifts. So she becomes very curious. Now Sharon is a little girl, but now she's paying attention to. She says, what is the gift? I say the first gift, I think, and if you tell her the day that you're going to give this gift to Sharon, watch her eyes. I think there's a good possibility her eyes will get bad. She says, she will start crying. I said, maybe she will cry, but let me tell you what the gift that I'm thinking. The day of her college graduation, I want you to throw a big party for her, and I want you to be in excellent health and organize that party. That is your gift. And then she looks at me and she doesn't know how to take it. And finally, she says, and what's the second gift? I said that on the day of wedding, you are in perfect health and you celebrate that special day for her. And then I tell her, but I'm pretty clever, okay? I am very clever. Did you know why I straight went to your daughter Sharon? Because I'm telling you that you have to be willing to study this and prepare yourself to give that gift. Because you are not going to, as it is, you are very close to diabetes. As it is, your kidney test, creatinine test is rising. It is telling me you are on the path to dialysis. So my dear friend, you are not going to be in a position to give those 2 special gifts to Sharon when you would need most, unless you now realize that you have to clear out your liver. It is loaded with fats, fatty change of the liver. Okay, you have right now you have a lot of inflammation in your body. So this is the diet and this is the food that you need. These are good foods for you. They will help you that day give that gift to Sharon. See, I'm putting her on a guilt trip. I don't want her today, the next week you are going to lose 7 pounds in weight. I'm not interested in that. I am, frankly, I will share one thing, as we have been friends for a long time. Whenever I see somebody who's had long-standing problems, let's say GERD or gastritis, endoscopy, this and that, if this patient comes back 4 days later and he's very happy, I give him some nystatin, I gave him some gastric enzymes, I gave him some guidelines for the food, I gave him how to do castor oil on the stomach, pit of the stomach for GERD, I gave him a little bit for the liver castor oil, and so he's ecstatic. He says, doctor, I've been going to endoscopy and I've been taking that Prilosec pills, etc. I'm not happy deep inside. I share his happiness and excitement because initial results are good. Because I'm not the type of the doctor who's interested in dazzling people with initial results. That's why I take that woman to Sharon, the day of Sharon's college graduation and the day of Sharon's wedding. And you know, it works because then I will write a little note, Sharon, Dr. Sharon, and I will write two gifts. So I will have a visit with her, let's say a year from now. And I know I wrote that two gifts, I know what those gifts are. So I will bring the conversation back to that. You should look at their faces. They learn something about me. This doctor cares. They may not know how much I know or how much I may not know, but I have finally gotten through them that I do care. And I think the doctor care is infinitely more important than how much knowledge doctor has. And you know, somebody might contest, well, you know, if you're going to operate and take somebody's lung cancer, you have to know how to take the right part of the lung, etc. That's true. But my comments are long term. My comments about health preservation. It's about respecting the dignity of our body and the dignity of other people. And if you apply those criteria, then I'm on a very solid ground.
And that just brings us right about to the end of this program, this edition of Science, Health, and Healing. I want to remind everybody that you can always check out Ali Academy at MajidAliMD.me. That's MajidAliMD.me. Thank you so much for joining us tonight, Dr. Ali.
Always a great pleasure, Richard. Richard, you're a great friend, personal friend, but these works that we do together, it's really very rewarding. Thank you. Thank you.
It did me a lot of good to hear them. Thank you. Thank you again.
Bye.